Dr. Paul Farmer is an internationally renowned global health advocate and medical anthropologist. He has given his life to his career, shaping global healthcare and becoming known as the voice of the poorest of the poor. Dr. Farmer is the chief strategist and co-founder of Partners in Health, where he and his colleagues focus on community-based treatment strategies for infectious diseases in resource-limited regions of the world. Dr. Farmer has raised money through tireless efforts to build hospitals in regions where there were absolutely no healthcare facilities. This sacrifice to underserved regions across the globe has led him to Haiti, Rwanda, Peru, and other disadvantaged regions where he has treated and saved impoverished patients for more than 30 years.
The great innovators of our time are said to be the titans of technology, the inventors of the microchip, the founders of Microsoft, the guys behind Google. But far from Silicon Valley, another great thinker and innovator is changing the world with far less fanfare. He's Dr. Paul Farmer. More than 20 years ago, he and a few other great minds created a charity called Partners in Health. In the years since, they revolutionized the delivery of healthcare worldwide, saving millions of lives in places where no one thought there was any reason for hope.
Dr. Farmer and his Partners in Health soldiers began their mission after visiting Haiti. It was here in Cange that they opened what was the first and only medical facility in the entire region. Local villagers pilgrimaged by lining up and sometimes even sleeping outside for hours to await their opportunity for medical care. Dr. Farmer estimates that approximately 10 million people perish annually around the globe from treatable illnesses such as tuberculosis, malaria, and AIDS. These 10 million deaths are by no means without severe pain or serious discomfort felt by the individual, the family, and the community. It is this horrible reality that has been a call to action for Dr. Farmer and his colleagues at Partners in Health. While they are indeed passionate and committed to championing for healthcare equality, Dr. Farmer understands the need for a community-involved global response and is committed to training a new group of medical soldiers to follow in his footsteps and continue to save lives all over the world. Dr. Paul Farmer continues his tireless work advocating against medical conventional wisdom, which has believed that there was no point in providing funding and medical care to third world nations. In the fight against AIDS in the 1990s, Dr. Farmer fought for funding and treated ailing patients in Haiti. The successful results are undeniable, patient after patient.
Paul started treating people in 1998 in Haiti. Everyone said he was absolutely nuts, impossible, can't be done, and forget about it.
Dr. Jim Kim is a professor at Harvard Medical School and one of the co-founders of Partners in Health.
And here we are, not even a decade later, where the goal is to treat every single human on the planet who needs HIV treatment with the right drugs.
And look at this man stricken with tuberculosis. They saved his life and thousands like him.
Similar results have been seen with the work that Dr. Farmer and his colleague have done with the treatment of multi-drug resistant strains of tuberculosis. Results that have saved countless lives and have paved the way for a new gold standard in treating this disease and many others. Are crucial partners of the new ASCP-led Coalition, Partners for Cancer Diagnosis and Treatment in Africa, and will champion the efforts to ensure access to care and treatment for patients. According to ASCP President Dr. David N.B. Lewin, Dr. Farmer's work through Partners in Health for HIV and TB patients, particularly in Africa and Haiti, dovetails with the dedication of ASCP volunteers working to advance laboratory practice in resource-limited countries that ultimately improve patient outcomes.
Farmer and Kim figured out not just a new way to treat multi-drug resistant TB, but a cheaper way to provide the medicine. Their breakthrough has become the new standard to save the lives of people around the world.
Partners in Health established the local healthcare workers platform as an essential component to ensuring ongoing positive impacts to global health initiatives. According to Dr. Farmer, the astounding results are that their patients in globally depressed areas with AIDS and tuberculosis remain healthier longer than similar patients in the U.S. As a result, the local healthcare workers platform has been launched here. And through advocacy, education, community collaboration, and leadership by such visionaries as Dr. Paul Farmer, we are indeed making strides and saving lives. Today, we celebrate the ongoing leadership of Dr. Paul Farmer. He continues to provide guidance on how to improve health and well-being in resource-poor settings based on his experience building models of community-based medicine.
Paul Farmer's success has made him a celebrity in the world of global healthcare. He won a MacArthur Genius Award. Heady stuff for a man from humble means. His mother was a grocery store cashier, his father a school teacher, who chose an unconventional lifestyle for his family.
You grew up on a bus?
It was actually a bus that had been used to take x-rays in a tuberculosis screening program. You see, this is why I don't like talking about my biography, because that sounds so neat, right? I lived in a bus.
Neat? It's pretty hardcore to me.
Well, there you go. No, but I mean, it was a tuberculosis bus, and then later I became a tuberculosis expert.
He came from a family of 8, and he said even though it was crowded on that bus in Florida, he didn't feel deprived, but rather adventurous.
Yeah. You ate your meals on the bus?
We did. Until we moved on to the boat.
Lived on a bus for a while, then on a boat?
Yes. With a tent in between.
How did that kind of upbringing shape who you are now, you think?
Well, you know, when you grow up in those conditions, surrounded by affection, and but not having a lot of things, because you can't put a lot of things for 8 people in 28 feet of space, then you get pretty resilient.
He went from the bus to a scholarship at Duke University and then to Harvard Medical School, where he's on the faculty. He married a Haitian woman and they have 3 children. Though he travels the world, Paul Farmer insists Haiti is home. Services are free, but he still accepts gifts like the occasional rooster.
Dr. Paul Farmer is no ordinary man. Dr. Farmer is a hero. Described by ASCP CEO E. Blair Holliday, Dr. Paul Farmer is hailed a premier change agent for global change.